Hey everybody, it's Dr. Kingsley with BetterVet.
I'm Rachel, and this is Chaos with us today.
And today we're gonna dissect potential causes of vomiting, when to be concerned, how to treat it. Yeah, let's dig in. Unsavory topic, but it is one we get a lot.
And just like you or I, our pets can vomit for many different reasons. So some of the top ones that we see are dietary indiscretion, which can include toxins as well, chronic gastrointestinal disease, acid buildup in the stomach, and then we can also see pancreatitis, other general diseases or issues of the GI tract, and motion sickness as well.
So we'll dig into a few of these. So going back to the dietary indiscretion and toxin, it's super helpful to look around the environment, not just in your home, but also in your yard, anywhere your pet may have had contact, to get into something that they may not have. Plants and things in the yard, like a decaying animal or trash that may have gotten there, those are all things that if you can identify is super helpful to your veterinarian in order to get the right medications and treatment to make them feel a little bit better. Diving into chronic disease that you mentioned, this is usually something we see in older dogs, and it's usually something that goes on for a while. It's not something that just comes on like a freight train. It's usually a slow progression of intermittent gastrointestinal signs. Oftentimes we'll see it paired with diarrhea as well. Sometimes their appetite can change. We might see some weight loss. But again, we're talking weeks to months, not necessarily acute days. The acid reflux component, usually we see that early in the morning, first thing. It's usually undigested food, either bilious vomit or a little bit of clear vomit. And oftentimes, like you said, just spacing out their meals can oftentimes fix the problem. Other times we need to look at doing a diet change or potentially give them an antacid or something of that sort, just like a person with acid reflux.
Mm-hmm. A few other things that can cause normal vomiting is motion sickness, like we discussed. They can get that too, and they can also have anxiety in the car that causes them to vomit, which you might think is motion sickness. Either way, there are treatments, and we can prevent that if that is happening with your pet.
And finally, we'll get into the two more emergent ones. Usually we'll see this in younger animals. Oftentimes it'll happen very suddenly. We'll go from having a perfectly normal pet to one that is pretty sick, not feeling very good, pretty punky, acting painful. They may be panting more, shaking, not wanting to eat. Other signs might be more subtle. Sometimes they develop a little bit of diarrhea. The first thing that comes to my mind is that they've eaten something that's now obstructed their gastrointestinal tract. It can be a toy, a sock, a towel. Corn cobs, of all things, are really, really common. If you're seeing things in their stool that could be related to something and their gastrointestinal signs aren't improving, then I would absolutely get your pet into a vet and have them evaluated for it. Oftentimes, we'll take x-rays or do an ultrasound to try and look for the object that isn't moving the way it should be.
So sometimes there is a little bit of detective work involved in deciphering vomit. What are some major signs that we should definitely go in to a clinic and be treated?
Right. So if your pet is vomiting excessively, and when I say excessively, multiple times a day, if they're actively lethargic or their behavior's changed and now they're hiding, they're not wanting to come out, if there's a major appetite change and they don't even want their favorite treats, if there's any blood or anything in the vomit, those are all things where I would say go straight to an emergency vet if you can't get a hold of your regular vet.
And one of the big common questions that we get from pet parents is, what about grass?
Right, so grass can also fall into the normal category, but grass is one way a dog can self-soothe if they are feeling nauseated. Some dogs, actually, it's their normal behavior and they just like to go out and graze. But if your dog out of the blue is starting to graze on grass and having episodes of diarrhea or vomiting, that might be a sign that there's something going on that you might need to have a deeper look at.
And if we are noticing vomiting, is there anything we can do at home?
Really, there's not much. With some of the other things, I know we've already talked about some over-the-counter medications that we can reach for in a pinch, but Vomiting's not one of them, especially when we could be dealing with some of the conditions we mentioned earlier, like a foreign body or something like pancreatitis. That's more of an emergency. But if your dog is just having a run-of-the-mill, I have an upset stomach, I ate something that didn't agree with me, I caught a little bug, anything like that, there are veterinary-specific medications that are really, really helpful in making them feel better. There are some human medications that are also prescribed for humans that are also helpful that your vet may prescribe. And then once we've gotten the vomiting under control, which oftentimes has to be done with injectable medications if your dog is vomiting profusely, a lot of times we'll give them a pill and it won't stay down, and we have to give them an injection to get things under control, and then we can send them home with tablets when they're feeling a little bit better and can hold stuff down. But the other thing we want to make sure we're evaluating is their hydration status. If they're vomiting profusely and have other gastrointestinal signs like diarrhea, they're ripping through their normal fluids than they really should be. And a lot of times, even if they're drinking water, may actively be dehydrated and might need a little bit of a boost to help them feel better. The last thing that would be recommended for a pet that's vomiting is giving them a bland diet. Most of the time, if they're really feeling punky, they're not wanting to eat. But the last thing we want to do is get them feeling better and then introduce a rich diet that will put them right back in the same boat that they were in. And a lot of times after a couple of days, with a few of the medications we mentioned before, with a little TLC and bland diet, a lot of times they turn right around and feel better pretty quickly.
If I am concerned that my pet is having chronic vomiting issues, is there any benefit to having someone come to my house for that?
There certainly is. So for one, pets are often a bit more stressed when they go into a traditional setting for a veterinary exam. So they may try to hide some of their symptoms. They may be nervous and tense their abdomen. And so we can't get a good feel of what's going on, if there's something in there that shouldn't, or if they're already tense, if they are painful, it can be hard to detect. So if they're in a little bit lower stress environment, oftentimes we can pull a little bit more from the physical exam. And if they're otherwise stable, we can run a lot of the same tests to at least get the ball rolling and figure out why your dog is vomiting. The other thing we can do is if there's something in the environment that you don't recognize as potentially being toxic that your dog's chewing on, we may be able to identify it. Those are just a few of the upsides of having an in-home visit to get to the bottom of why your pet is vomiting.
That's a good point. A little extra help playing detective.
Right, exactly. I know we went from top to bottom on all things vomiting, but if you have any other questions or concerns, things we didn't cover, be sure to post them down below. Hit the subscribe button so you can stay up to date with all the latest tips and tricks.
And we'll see you next time. Thanks, y'all.
The acid reflux component, usually we see that early in the morning, first thing